And this is with respect to a big boost as far as India's vaccine drive is concerned. Vaccine for the 6 to 12 years category is here. DCGI has now approved Covaxin for the 6 to 12 age group. Bharat Biotech's Covaxin has got the emergency use authorization from the drug regulator. Those are the details coming in. This is the first vaccine to be approved for the emergency use for the 6 to 12 age category at this point in time. Those are the details coming in with respect to the vaccination for the 6 to 12 category, where the drug regulator has approved and given emergency use authorization for Covaxin. Sharon is joining us for more details here. Sharon, this is a big announcement coming in as far as emergency use authorization for Covaxin for the 6 to 12-year category.
Certainly, and this is the first ever vaccine that has in fact been given a green signal by the DCGI for the category age under 12 years. They had in fact submitted all their three-phase clinical trial data to the subject expert committee, who had in fact recommended the emergency use approval for Covaxin for the age category of 6 to 12, after which now DCGI has given the final approval, but with restricted emergency use approval. So with restricted use approval, we have to of course wait for the official note, what are the restrictions that has been put in place, but our sources have been telling us that the company has asked to submit safety data, including the data on adverse event with due analysis every 15 days of the first 2 months and monthly thereafter up to 5 months by this is what the restriction has been put. Apart from that, what are the other restrictions that has been put is something that we have to wait for the official note, but this is the first vaccine under the age of 12 which has been given and DCGI approval.
Well, absolutely, Sharon. In fact, what can you tell us in terms of, the next steps going forward? Of course, like you said, the details of the restrictions are yet to be known. But what happens now that the emergency use authorization has come until the point where, it starts getting administered?
Well, it all depends on what is the decision of the NTAGI and NECWAG as far as children vaccines are concerned. Of course, DCGI has done their job of giving an approval to the vaccine for such age category. But as we know, as of now in India, it is only 15 years and above who are getting their vaccination. So, of course, we have to wait by when will the NTAGI will decide whether children up to the age from 6 to 12 and over whether they will in fact be getting their vaccination or not, because that decision solely lies with NTAGI and NECWAG, after which they give their recommendation to the Health Ministry, and officially Health Ministry announces whether the children at this age group will get vaccinated or not. Of course, there are demands from the experts who have been saying that with schools being open, this is something that should in fact be enforced, that children who are at the age of 6 and above should in fact get vaccinated. So of course, we have to wait for an official confirmation on that.
Absolutely, Sharon. Thank you so much for getting us all of those details. So that's the latest breaking news that we're getting you at this point in time. The first approval coming in for the 6 to 12-year category for vaccines for children at this point in time. Covaxin has got that approval. So it's a big boost, the vaccine drive for children that we're talking about. It is restricted emergency use authorization that has been given to Covaxin for this category, which means there will be certain restrictions that will be put in place before the vaccine begins to get administered. What these restrictions are is something where clarity is still awaited, that once the official note is released for this emergency use authorization, those details will then become clear. But for now, this is a big step, and this announcement coming in for the DCGI approval for Covaxin for the 6 to 12 age group at this point in time. So we'll have to see how long before the actual administration starts. Dr. Yatin Mehta is joining us as well on the broadcast. Thank you very much, Dr. Mehta, for joining us. This, of course, is a big, announcement, big news for the vaccine drive, especially for children. What, in your view, is going to be the way forward, and whether or not the vaccine hesitancy by parents for this category might be a hindrance?
No, I think, yes, this is a very positive step because the schools have opened up. and the children cannot really maintain the safe distancing at school. And even if they are sitting at safe distance in the class, you cannot have a check on it while in the break periods and things. So they can transmit the infection. So although the infection is milder in children, but this would be closed at whole, which can lead to further increase in cases. Yesterday only I had a patient who would come to see me, and he was not sending his daughters to school because he was afraid that he was immunocompromised and the daughters will bring the infection from school. So if they are vaccinated, then this risk also reduces because they can spread it in the family if they bring it from the school. So I think also if the children are vaccinated, the hesitancy of the parents to send the children to school also will go down, and life can begin normally for the education and training. So I think it is important that every parent permits their children to have the vaccine, because not only it is necessary from the safety point of view and education point of view, but also from the psychological normal upbringing of the children.
Absolutely, Dr. Mehta. But when the vaccination opened up for, some of the younger age groups as far as children are concerned, even among the teens, we did see a lot of vaccine hesitancy. The response was not perhaps as was expected. Now that we are going into the even younger age group, do you think that could perhaps be a hindrance in terms of the number of people who come out and get their children vaccinated?
No, that is where the role of the media also comes into play. I think we need to educate the people and remove that fear. I think 1.3, 1.5 billion vaccine shots have been given in India. So these are all have a very good safety record. I think so. I think we should educate the public that they must go and protect their children also, and they will also be protected. So I think we must go ahead with it. That's the only way out.
Yes, absolutely, Dr. Mehta. Thank you so much for joining us with your perspective.